This is the story not so much of Rick Scott, but his company, Colombia HCA. At its height, the 9th largest employer in America and the biggest healthcare company in the world. It committed massive systematic fraud, which ended with what was the largest fraud settlement in US history. Bribes for doctors, turning away the sick, stealing from the taxpayer. You don't get rich from helping the needy.
You just don't know.
No. I don't know what files they keep. I don't recall. Oh, I don't know. I don't recall seeing that. I don't recall. I might have. I can't remember. I have no idea. First off, I don't know any personal knowledge. I'm not sure. I have no idea. I don't know.
Rick Scott was born in 1952 in Illinois. He was in the Navy for just a little more than 2 years after completing high school, after which he moved to Kansas with his wife, Ann Holland, where he studied business administration at college on the GI Bill. He graduated in 1975, and around this time he and Holland bought and operated 2 donut franchises. This allowed Scott to get his law degree from Southern Methodist University in 1978, after which he worked at legal firm Johnson & Swanson. While still working there in 1987, he and 2 healthcare industry veterans tried and failed to buy HCA, the Hospital Corps of America, for $5 billion, financed by Citigroup. The deal fell through, but shortly after, Scott and Richard Rainwater each put in $125,000 to start their own company, Colombia Hospital Corporation. Now $250,000, even in 1987 dollary-doos, might seem like an incredibly small amount of cash to start buying hospitals with, and you'd be right. You've got to spend money to make money, but who says the money you spend has to be yours? Rainwater, who died in 2015, was very well connected, surely the most important trait for a venture capitalist and financier. By this time had already spent nearly 2 decades managing the family fortune of the Bass family, helping them graduate from mere multi-millionaires to billionaires. In the 80s, Rainwater invested and bet Bass money in numerous oil ventures, invested nearly $500 million in Disney on their behalf, and around the time he went half-seas with Scott, he was estimated to be worth $100 million himself, maybe more. Despite this, Rainwater didn't funnel his own money into Colombia Hospital Corporation. Various articles talk about them borrowing money for their initial purchases, but none say from where. It seems, with Rainwater's name, they were able to borrow a large amount of money from a bank or banks. In 1988, Colombia bought 3 hospitals in El Paso and shut one down, consolidating some of its material assets into the other 2. Running the remaining 2 for profit, they started to make a lot of money, owning 4 hospitals by the end of 1989. In that year, Scott, Rainwater, and others partnered with George W. Bush to buy the Texas Rangers. Rick Scott's stated belief was that hospitals could be run better if they were run for profit. They certainly made a lot of profit. In 1992, Colombia owned 38 hospitals in the US. In September of 1993, with Scott at the helm and Rainwater apparently uninvolved or at least unseen, Colombia bought an additional 71 hospitals from Humana for $4.3 billion. And in the later half of that year, Colombia began the process of merging with HCA in an $8 billion deal. By the beginning of 1994, after Colombia and HCA merged, Colombia HCA Healthcare owned 197 hospitals and projected a revenue of $11 billion for that year. Speaking to Time magazine then, Scott wondered if his company might own 500 hospitals by 2004. Hell, why not 1,000? But here's the thing, when you run something for profit, even if that something is an essential service like healthcare, the profit becomes the most important thing. And along those lines, here, maybe, is an ad for some crap you don't need. Sorry about that. Why not treat yourself and stick it up your arse? I've got a toy lightsaber up there right now, playing havoc with my spleen. I regret nothing. The overt plan was to create an economy of scale where costs could be decreased by purchasing materials in bulk and sharing resources, like specialist doctors, between hospitals. The idea was that the more hospitals under the same administration, the same umbrella, the cheaper they are to run. I'd say this is a great idea, and that all hospitals should be run by just one company, but that would be very dangerous to give one company so much power, so I guess it'd have to be run by the government or something, and that would never work. According to the New England Journal of Medicine, Colombia HCA deliberately misrepresented themselves as award-winning and prestigious, and were reprimanded by the National Institute of Science and Technology and the Commerce Department. The journal also points out that a 1995 report for Colombia HCA by Healthcare Management Decisions Inc. characterized 5 of 6 nonprofits that compete with the company in Central Florida as providing negative community benefits and creating a net community burden because the value of their tax exemption exceeded that of their charity care. But I think you could argue that the value of care, especially long-term, cannot be expressed numerically, never mind financially. Colombia HCA also funded a 1994 study that concluded non-profit hospitals provided more than double the free care provided by for-profit hospitals, and contributed about 1.1% of their revenues to medical education, compared to for-profit hospitals that contributed effectively nothing. Yet, with tax exemption considered, the for-profit hospitals, who funded the study, return more, somehow, to society. Yet numerous studies, more recent yes, but in the 90s too, found that for-profit hospitals were generally more expensive because, there has to be a profit for the investors or shareholders. A profit that doesn't need to exist in hospitals that are run for, the health of the community. Anyway, Scott's Costconomics weren't the only way Colombia HCA brought in money. The company would try to acquire struggling or underfunded hospitals, sometimes by threatening to open a new hospital next door just to destroy them. They cut costs at every opportunity, buying non-profit hospitals and slashing community programs, and heavily skimping on training. One Colombia administrator reportedly said training that would take 6 months at other hospitals would be crammed in to as little as 2 weeks in a Colombia HCA hospital. The New England Journal of Medicine also says that, at least according to staff, Colombia HCA cut costs by deliberately understaffing nursing shifts, replacing registered nurses with staff trained in-house, without the same level of professional qualifications that were generally the standard, and by introducing inferior supplies. Some patients who were unprofitable to treat were sometimes dumped, that is, discharged or moved elsewhere, even if they were not in a stable condition, and even if it was dangerous or medically unethical to do so. As it grew, Colombia HCA especially relied on referrals from local doctors. It tried to secure these with kickbacks, not unlike the way the Sacklers tried to woo doctors in their quest to get America addicted to OxyContin. Expensive dinners, lavish trips or functions, loans with no expectation of repayment, office rents paid for, all created an ecosystem of corruption where many doctors served their patients second and themselves and Colombia first. Analysis by the University of Auburn estimates that Colombia paid just under $7 million in kickbacks just in El Paso, and from that generated more than $100 million in Medicare business. These kickbacks were acts of serious corruption that were ongoing since at least 1994. If you can't trust your doctor to send you to the right hospital or pursue the correct medical treatment because there's no money to be made, who can you trust? But how Colombia HCA billed Medicaid and Medicare, that is, the United States government, was pure fraud. Thanks to more than 30 healthcare professionals with the spine to become whistleblowers, the FBI sank its teeth into Colombia HCA in March of 1997, starting at El Paso and expanding their investigation to the rest of the company in July, the same month that Scott resigned under pressure from the board. Their investigation uncovered fraud on a massive scale. The company had been overcharging Medicare, Medicaid, and TRICARE patients, that is, military and ex-military patients, almost all the way back to Colombia's inception in 1989. They overbilled government programs for lab tests, conducted lab tests when they weren't needed, they misreported diagnoses to the government to inflate reimbursement costs, they lied about their property taxes and tax liabilities, they charged the government for community education that was just in fact their own marketing. Yes, the taxpayer footed the bill for a chain of private, for-profit hospitals making $19 billion a year at its height for advertisements. And that's not all. When Colombia HCA bought out other hospitals, it fraudulently claimed administration and management fees as medical expenses. They further bumped up profits by providing home visits for patients that did not need them, or sometimes not providing home visits but claiming that they did. The FBI called the fraud systematic and said that it was perpetrated by corporate officers, including CEO Rick Scott, the company's president, and the company's corpo in charge of internal auditing. They even had a secret fund of up to $1 billion to pay back Medicaid, Medicare, or insurance companies that asked questions. They knew what they were doing was fraud, and it was intentional from the very beginning. Scott was deposed in 2000, where he pleaded the Fifth Amendment 75 times. His public explanation has always been the Sam Bankman-Fried defense. I'm a terrible businessman with no idea what's going on in my own company. At the end of that year, HCA pleaded guilty to 14 felonies, and by 2003 had paid $2 billion to the United States government in criminal fines and civil penalties. But no one went to jail, and Scott escaped unscathed. Instead, he went on to other highly profitable ventures, including co-founding Salantic, a chain of walk-in clinics in Florida. By 2010, Salantic had faced 10 court actions for, amongst other things, you guessed it, Medicare fraud. In 2009, Scott created the political organization Conservatives for Patients' Rights. Now basically defunct, it promoted free market healthcare reform solutions, and essentially opposed the healthcare reform this country clearly badly needs, criticizing Obama's medical reform plans as socialized medicine. Oh no! Why is this man free? You tell me. And then he just kind of disappears. I'm not really sure what he went on to do. Oh no, wait! He became the governor of Florida between 2011 and 2019, and he's now senator. And even though Rick Scott has just failed in his bid to become Senate Majority Leader, he did win his re-election easily, and he's floated the idea of maybe perhaps one day running for president, which makes perfect sense in the context of our mass psychosis. In other news, as you may know, I don't really like sponsorships. I don't really like videos that have sponsors in them. And guess who wants to sponsor me? L'Oreal. L'Oreal! What are you thinking? I'm the sort of dude that doesn't wear aftershave. I just throw gin on my neck twice a year. L'Oreal. Depressed yet? Let me tell you about L'Oreal. Founded by an anti-Semitic fascist who employed loads of French traitors after World War II. In Germany, their headquarters until 1991 was built on property stolen from a Jewish family that was gassed in World War II. Don't go, there's more. Well, alright then. Join me on Blue Sky. It's the new Twitter, I guess.